Hello, friends. Starting this September, major federal rule changes and mandatory notices are arriving in the mailboxes and bank accounts of millions of American seniors, bringing financial updates that can save households hundreds and in some cases thousands of dollars. From an official September 30 deadline that eliminates a decades-old penalty on Social Security benefits, to brand new Medicare payment structures rolling out for the upcoming coverage year, three critical shifts are taking effect that directly impact retirement budgets across the country. Rules governing Social Security, Medicare, and senior assistance programs are shifting rapidly, and staying informed is the single best way to ensure that eligible benefits and cost-saving opportunities are never overlooked. If you want to keep up with every policy update, benefit change, and regulatory deadline as they happen, please hit subscribe to Dark Macro by Walter Berron. That way, you will always stay ahead of the curve as federal agencies roll out new updates for American retirees. Let us look closely at the details, starting with surprise number 1, which involves a mandatory document arriving in mailboxes before the end of September. Surprise number 1 is the arrival of the Medicare Annual Notice of Change, widely known as the ANOC, and the nationwide introduction of the Medicare Prescription Payment Plan. Under federal regulations, every private insurance company offering Medicare Advantage plans or standalone Medicare Part D prescription drug plans is legally required to deliver the annual notice of change to enrollees by September 30. This document outlines every single adjustment to premiums, deductibles, co-payments, drug formularies, and provider networks that will take effect on January 1. The major news arriving inside the September notice centers on how seniors can pay for their prescription medications. In previous years, seniors taking costly specialty brand name drugs for conditions like cancer, rheumatoid arthritis, diabetes, or cardiovascular disease frequently faced massive bills at the pharmacy counter in the early months of the year. A retiree could easily be asked to pay several hundred or even over $1,000 in January or February just to satisfy their deductible and initial coverage phase before catastrophic protections kicked in. Under the Medicare Prescription Payment Plan, participating beneficiaries can elect to spread those out-of-pocket prescription expenses across predictable monthly payments throughout the entire calendar year with $0 due at the pharmacy counter upon pickup. Instead of facing a massive upfront financial burden in January, the pharmacy bills the insurance plan directly, and the plan sends the enrollee a monthly statement dividing the accumulated costs into manageable monthly installments across the remaining months of the year. This payment structure works in tandem with the federal out-of-pocket cap on covered Part D medications, which places a hard annual ceiling on what any enrollee pays out-of-pocket for covered prescriptions during a calendar year. For seniors managing high-cost prescriptions, having the ability to spread those cap costs evenly across 12 months provides significant cash flow relief and prevents sudden financial shocks. According to the Centers for Medicare and Medicaid Services, anyone enrolled in a Medicare Part D plan or a Medicare Advantage plan that includes prescription drug coverage is eligible to participate in the Medicare Prescription Payment Plan. Participation is completely voluntary, and insurance companies cannot charge any fee or interest to join the program. It does not alter the total cost of medications over the course of a year, but it changes when those payments are due. For beneficiaries looking to evaluate their options, the recommended next step outlined by Medicare is to review the annual notice of change as soon as it arrives in September. If the notice does not arrive by September 30, or if someone wants to compare plans ahead of the annual open enrollment period running from October 15 through December 7, Medicare provides the official Medicare Plan Finder tool online at medicare.gov. Beneficiaries can also contact Medicare directly by calling 1-800-MEDICARE, which is 1-800-633-4227, available 24 hours a day, 7 days a week, with Thai assistance at 1-800-77-486-2048, or reach out to their individual plan sponsor to request a Medicare Prescription Payment Plan participation form. Surprise number 2 is a major Social Security Administration rule change taking effect on September 30 that eliminates food from in-kind support and maintenance calculations. For decades, the Supplemental Security Income Program, known as SSI, has enforced a strict regulation regarding what the government defines as in-kind support. Under the old regulation, if an elderly parent or individual receiving SSI lived with family members who provided groceries, if adult children brought over meals, or if friends assisted with food shopping, the Social Security Administration counted that assistance as unearned income. Under that previous policy, the government automatically applied a penalty that reduced the beneficiary's monthly side check by up to 1/3 of the maximum federal benefit rate. In real dollar terms, this meant vulnerable seniors often had roughly $314 to $330 deducted from their monthly benefit check, simply because family members or community members made sure they had enough food to eat. Beneficiaries and families were forced to answer intrusive quarterly questions regarding who bought groceries, who ate meals together, and how much money was spent on household food. Starting September 30, the Social Security Administration's final rule officially removes food assistance entirely from the calculation of in-kind support and maintenance. Under the updated regulation, the agency will no longer inquire about, calculate, or penalize C recipients for receiving food or meals from family, friends, or nonprofit organizations. Shelter expenses such as rent and mortgage contributions will still be evaluated, but food is permanently excluded from the equation. This change directly affects low-income seniors aged 65 and older, as well as individuals with disabilities who receive supplemental security income. In the United States, millions of older adults rely on C to supplement tiny Social Security retirement benefits or to provide a vital income floor when they lack sufficient work credits for standard retirement. Under the new rule, families can freely purchase groceries, deliver hot meals, or pay for food delivery services for their elderly loved ones without causing any reduction in the recipient's monthly payment. For seniors who currently receive SSI and have historically had their monthly payments reduced due to food support, the Social Security Administration has indicated that records are being updated to reflect the new policy. Beneficiaries or their authorized representatives can check their benefit status online by logging into their personal account at SAC.gov My Account, visiting their local Social Security field office, or contacting the Social Security Administration toll-free at 1-800-772-1213, with Thai services at 1-800-325-0778 Monday through Friday from 8 a.m. to 7 p.m. local time. Surprise number 3 is the broadened eligibility for the Federal Extra Help Program alongside state Medicare savings programs heading into the fall enrollment season. Many seniors mistakenly believe that assistance programs are only available to individuals with virtually zero income or assets. However, under expanded federal rules, the Extra Help Program, formerly known as the Part D Low-Income Subsidy, has opened its doors to a much broader group of retirees. In prior years, the federal government offered partial extra help subsidies to individuals earning between 135% and 150% of the federal poverty level, which required beneficiaries to pay partial deductibles and higher coinsurance. Under current rules, that partial tier has been eliminated, and anyone who qualifies up to 150% of the federal poverty level receives the full extra help benefit. The financial value of full extra help is substantial, estimated by the Social Security Administration to be worth approximately $5,300 per year in prescription assistance. Beneficiaries receiving full extra help pay $0 for their Medicare Part D annual deductible, pay $0 in monthly premiums for benchmark Part D plans, and pay fixed low co-payments for covered prescriptions, typically capped at around $4.50 to $4.90 for generic drugs and $11.20 to $12.65 for brand name medication. Furthermore, enrollees who qualify for extra help face no late enrollment penalties on Part D and receive a continuous special enrollment period, allowing them to switch drug plans once per calendar quarter during the first 9 months of the year. To qualify for extra help, an applicant must be enrolled in Medicare Part A or Part B, reside in the United States, and meet annual income and resource guidelines. For an individual, the annual income limit is approximately $23,940 with a resource limit of $18,090. For married couples living together, the annual income limit is approximately $32,460 with a resource limit of $36,100. When calculating resources, the Social Security Administration does not count a primary home, one vehicle, personal household belongings, or life insurance policies. At the same time, seniors applying for extra help are often screened for state Medicare savings programs, such as the Qualified Medicare Beneficiary Program or the Specified Low-Income Medicare Beneficiary Program. When a senior qualifies for one of these state programs, the state Medicaid agency pays the enrollee's monthly Medicare Part B premium, which currently returns $174.70 or more per month directly back into the senior's Social Security check. The official process to apply for extra help is straightforward. Seniors can complete the application online using Form SAT 1020 at SAGOV's Medicare Part D Extra Help or by calling the Social Security Administration directly at 1-800-772-1213. For free, unbiased, and local one-on-one assistance navigating both Extra Help and Medicare savings programs, seniors can connect with their State Health Insurance Assistance Program, commonly known as SHIP, by calling 1-877-839-2675 or visiting shiphelp.org. To summarize the 3 major developments covered today, first, by September 30, every Medicare Advantage and Part D enrollee will receive their mandatory annual notice of change, outlining coverage adjustments alongside the new Medicare prescription payment plan, which allows seniors to spread out-of-pocket prescription medication costs into equal monthly payments with $0 due at the pharmacy counter. Second, on September 30, the Social Security Administration's final rule officially removes food from in-kind support and maintenance calculations, ending the policy that previously reduced monthly C-checks by up to one-third when family members or community programs provided food assistance. Third, the expanded federal Extra Help program and state Medicare savings programs provide eligible retirees with up to $5,300 in annual prescription savings and the potential reimbursement of their monthly Part B premium, accessible through Form SA-1020 on SA.gov or through local SHIP counselors at shiphelp.org. As a reminder, this report is intended solely as general educational reporting on public programs, federal regulations, and published agency guidelines. It does not constitute personalized financial, legal, tax, or medical advice. Because eligibility rules, asset limits, and program benefits vary based on household income, state residency, and individual health circumstances, viewers are encouraged to confirm the exact details of their situation directly with the Social Security Administration, Medicare, or their local state benefit agencies. If you found this breakdown helpful and want to stay updated on future rule changes, benefit updates, and critical deadlines for American seniors, please hit subscribe to Dark Macro by Walter Berron and share this video with friends or family members who could benefit from this information. Thank you for watching, and stay tuned for our next update.